Well, while this pandemic has affected us all, few have been as affected as the people on the front lines, our healthcare providers. We are joined now by trauma surgeon Elliot Hout of Johns Hopkins Hospital. Thank you so much for being here. You are also the chair of TraumaNet, and we wanted to talk to you a little bit about what you're experiencing right now, being a trauma surgeon. What are you seeing?
So I think the important thing to know is I do trauma surgery, but me and my partners who do trauma also do all of the emergency surgery, general surgery. If you come in with a problem with your gallbladder or appendicitis, we're treating you. And many of us are also trained in critical care medicine. So some of my partners are also at the front lines in the intensive care unit treating for COVID patients. They've been pulled off their typical trauma and surgery duties to be doing that to bulk up the clinicians we have in the ICU.
And in doing that, you've got to make sure that you've got all this protective gear. Do you have what you need right now? And can you walk us through the protective gear that you're using on a daily basis right now to fight COVID-19?
Sure. So you've probably heard about all this PPE that people are talking about. So if I were going in to see a COVID patient or a trauma patient and we don't know if they have COVID, I would start and I'll show you what it looks like. So I'm going to put on my hat.
Yep.
Going to cover up everything here. This is what people have been hearing about the N95 mask. I'll try to yell through it because it is hard to talk and breathe through.
Okay.
So there's my N95 mask.
Okay.
Then I would put a surgical mask over top of it to protect that mask because that mask has to be reused again and again.
Oh, wow.
And then I have a face shield. I put my name on because nobody can even recognize me. So now they know at least who I am.
Right. And is it a barrier when you are, I mean, it should be a protective barrier, but I'm wondering about when you're interfacing and interacting with your patients. Is it challenging to do the same job that you did before all of the gear?
Absolutely. So, normally if you were to come to my office, I'd be looking you in the eye, I'd see you, you'd be able to see my face, you'd be able to hear me really well.
Yes.
Now we're seeing patients and you have to yell through an N95 and all these other things so patients can hear you. And you don't have that human touch, that human interaction, that face-to-face discussion. If I'm discussing, you need major surgery right now, you can look me in the eyes, but you don't see anything else. I'm mostly covered up and it really is a different feeling. And also the temperature gets super hot and all that extra protective gear. And we're used to wearing some of it, but this makes it a lot worse. And breathing through an N95 mask is not easy. It's intended to be hard to breathe through because it filters a lot of stuff. Being in that for an hour, 2 hours, or I haven't been needed to do it for 12 hours, I don't even know that I could even comprehend that.
That's the thing. And we're seeing a lot of our healthcare providers that are posting on social media so that we can sort of get an idea of not just the mental load that they have right now, but that physical load. How can we as a community help our healthcare workers as they're fighting this pandemic?
Hey, before I answer that question, I'm going to show you one other thing of PPE that people have been hearing about, just so I don't forget. So people have been hearing about a PAPR. So this is the powered thing. So this whole thing goes over my head. It's like a plastic bag.
Okay. Oh, wow. Yeah.
And then there's a blower that blows fresh filtered air in. You wear a battery pack on your back and that blows fresh air in there. So those are what you've also seen people talking about a PAPR. That's a powered air purifier, a different piece. And some of those are equivalent that you can do interchangeably. So
and you would be doing that in lieu of all that you showed me.
Exactly. Instead of the other things, depending on what procedures we're doing, the highest risk procedures, you might be wearing this PAPR instead.
Well, I'm glad that you showed it to us because you're right. We're hearing these terms, but we're laymen. We don't know. And again, we want to help. So what is it that we can do?
So I think number one is social distancing. That has been the thing that the lay public can do. We hear all this data about wearing masks and people are recommending wearing masks as well. I do when I go to the grocery store now, but I think the social distancing is the real key. And try to stay away. Don't do things that you don't absolutely necessarily have to do. My kids haven't been anywhere in weeks. They're at home and they are social distancing in the house.
Yes. Yeah. My child as well. It's a part that we can do. We can't do a lot, but our healthcare providers are asking us to do that. That's the least that we can do. And I'm also wondering, in terms of representing TraumaNet, what is the organization doing right now and what is your focus as part of TraumaNet?
So TraumaNet is a nonprofit that we represent all of the trauma centers across the state of Maryland. And we routinely talk about how do we optimize trauma care for people who live in Maryland. So we know we have a great system in Maryland with a helicopter system, trauma centers spread throughout the state, and really high quality trauma care. We as a group work together from all the trauma centers to keep that going and drive the best practice. So that's what we do on a routine basis. Now that things have changed, we would hope that trauma is becoming less of a problem during the pandemic. Unfortunately, it's not. And we are still seeing people who are crashing their cars. We've seen a lot of ATV crashes. More and more kids, they're not in school, so they're out riding their bikes and other household injuries. We're seeing more of that as well. We're seeing these spikes. Please be careful out there. I know a lot of people have been doing home improvement projects. You're stuck at home, you might as well do this or that. And we have seen people injured with power tools, falling off ladders, things like that. So now is not a good time to have to come to the hospital. If you have COVID and you're sick, please come, but please try to prevent these types of injuries like you should all year round. No drinking and driving, drive the speed limit, wear your bike helmet, all these other things that we're pushing year round to help people prevent trauma and injury now is even more important, because those beds that you might need to go into might be full. The operating room is running at bare bones capacity because we're dealing with COVID. The more you can do to stay away from the hospital for trauma-related reasons, the better.
Well, I appreciate you taking time to tell our viewers and tell myself all about this. It's really, really helpful, and good reminders just to be careful and safe while we're at home, because we all should be right now. And yes, thank you for your time. And we'll be right back with more Midday Maryland right after this. Stay tuned.